Good evening, everyone. Thank you for joining us and welcome to the Basalt Regional Library for Let's Talk About It Vaccines. I'm Kathy Click, Community Engagement Coordinator here at the library. This conversation is the result of a grant we received from Communities for Immunity, a program of the Institute for Museum and Library Services and the Center for Disease Control and Prevention. Communities for Immunity provides funding awards and support to museums and libraries, engaging their communities to boost COVID-19 vaccine confidence. As trusted community partners, museums and libraries play a critical role in building vaccine confidence and fighting the pandemic. Our project includes this conversation with public health representatives and a graphic essay the library commissioned to present vaccine hesitation and resistance in a relatable form. The essay, available in English and Spanish, will be distributed at the library and shared with other venues, both regionally and nationally. Our guests tonight are Kathy Chandler-Henry, Eagle County Commissioner, Carly Senst, Pitkin County Testing Immunizations Analyst, Ileana Renteria, Social Media Strategist and Outreach Consultant for local nonprofits and businesses, including the Pitkin County and Colorado Department of Public Health, Dr. Gail Meisner of Mountain Family Health in Basalt, and R. Allen Brooks, professor and graphic novel writer. We're also joined by the director of the library, Amy Shipley, and we will be joined shortly by Greg Poshman, Pitkin County Commissioner and Chair of the Pitkin County Board of Public Health. Thank you all for being here. Welcome. And I have a few questions I just want to ask, and I hope that opens up a conversation that we can have between ourselves and pass information along to our community. So these are not pointed or assigned to anybody, but I have some questions. Both Pitkin County and Eagle County have high vaccination rates. Kathy, particularly for you and Carly as the immunization analyst, do you feel there were challenges in getting people fully vaccinated?
I think there are always challenges. We had some pretty enthusiastic folks at the beginning when we were doing vaccinations for the older population. And then as those spread to other age groups, we started to see a little more hesitancy. And as it got down even into the younger groups, there was more hesitancy there. At the beginning, not so much. And sometimes the hesitancy just came from logistical issues. It was hard to figure out how to get to a vaccine clinic, especially as we were ramping up and trying to get those going. So the better we got at it as a county we had huge drive-through clinics at the fairgrounds, and the better we got at doing those things, having them spread out through the Roaring Fork Valley and the Eagle River Valley, I think that really did help some of the hesitancy because it was easy. And we heard people say, well, I'm just driving home from work. I saw the line of cars. I thought I would just come and do it. So I think convenience was a huge part of hesitancy. Hi, Greg.
Yeah. Hi, Greg. Welcome.
Hi there. Sorry I'm late. I had a Board of Commissioners meeting that ended 5 minutes ago, and then I couldn't find the link. So I'm glad to see you all. Ileana, I'm so glad you're here. Gail, Kathy, Carly, thank you. And Alan, good to meet you.
Likewise.
And I will kind of mimic and go second on what Kathy said is Pitkin County, I think, experienced very similar trends, right? Like that first really big push on very motivated individuals that had been waiting with bated breath. We were really fortunate to be able to stand up those mass drive-through clinics pretty early on in January 2021. So that was a huge success and took a lot of community engagement and a lot of community partnerships to pull off. And then again, to kind of Kathy's point, recognizing where the gaps in vaccination interest were and sort of what were those barriers that people were experiencing. I think hesitancy is a really big catch-all word, which I know that we'll get into a little bit here, but it's not just one thing, right? Like we have barriers logistically, like Kathy was mentioning, we have workplace concerns. We have a really dominant working population of young people who taking a shift off of work to go get a vaccine isn't typically in their go-to, you know. We had a lot of insight from Ileana, worked really, really closely with us to make sure that our information was getting out in really effective ways. I know Dr. Misner has been working relentlessly through her patient base that covers multiple townships and counties within the Valley. And so really working with a lot of community partners to identify what those barriers are, why weren't individuals seeking that vaccination, and really working towards making it as accessible as possible, and really making sure that the information was good, the information was accessible. I can't remember what you called it, the comic strip that Alan worked on, that was amazing. I thought that was great. And so we really worked on figuring out and hitting on all cylinders, getting the information out and making it as readily available as possible.
What do you think were the barriers? Besides convenience and just like, I don't have time to get it right now. Did you come up against actual real, walls that you could not get through?
And I think it's tricky, because I think that we shouldn't discount those barriers that are readily identifiable, because that's oftentimes the big ones, right? And so in working in order to be dynamic enough to address those that were readily available, we knew what those were and how do we rectify that. We also had an amazing outreach team. Greg was part of it for more than a few weeks. We called it our street team. So we actually had individuals, every team that we had was at least 2 people, bilingual, bicultural, had vaccination flyers with really, really short snippets of information, just in case there was misinformation or any sort of confusion about vaccination facts, as well as direct calls to action for scheduling. And those teams were incredibly dynamic. We set them loose on the town. They walked into kitchens, they walked into retail, they were straight up door to door, walked into construction sites. Those stories cracked me up. And they certainly were our boots on the ground and really sort of were the faces of the vaccination effort. And what they would constantly come back to us with is that it helped having a person, that it wasn't public health doing this, it wasn't me on a screen saying please go get vaccinated, even though that's very helpful, but these were people who were armed with facts, who were armed with really good information, and were saying, hey, you can come by tomorrow, there's a clinic tomorrow, block over there, you don't even have to schedule, please walk up, and we're available to answer any of those questions and kind of take that very human approach to conversing about vaccines. And sometimes that's all it took, is that they ultimately just needed somebody to give them good information. It was a kind face that in some instances spoke their language. And they were told, hey, this is as easy as it could be. You don't have to make an appointment. You don't have a doctor's note. You don't need insurance. You don't need any of that. Please just come on by. We'll get you sorted in 15 minutes. And so what we took away is that human element was really critical to addressing those individuals who are on the fence, even all the way up to vaccine resistance is something that we came across a few times. And I will say that our street team knocked it out of the park. Those conversations were tough, and it always ended in a handshake. We had one construction site that it started out a little belligerent and ended in handshakes all around, and 10 of that work crew coming through to get vaccinated the next day, which is really a testament to those team members who were out there doing that work.
Congratulations. That's awesome.
That was a fun part of the pandemic, I should say, if there's such a thing.
Can I ask a question? I'd love to ask a question of Ileana and Dr. Misner regarding the Latino community. The few experiences I had where some people from the Latino community came to me and asked about vaccines and then told me their story of getting vaccinated and how they were trying. I know it was gratifying to hear that, but you were much closer to it. And I was wondering if either of you could share with us something about that, because that would be great information for me and to take back to my Board of Health. Either one, if anyone wants to say something.
I can start. I actually found, certainly, especially initially, that in my Latinx population, I had very little difficulty convincing my patients to get vaccinated. That was particularly patients who knew me, trusted me, knew that they themselves had chronic diseases that put them at higher risk. I then, as time went on, I confronted barriers that included things that have already been mentioned, like I can't miss a day of work, particularly as the tendency to have something of a reaction for the first 24, 48 hours after the vaccine got better known. People would be reluctant because they didn't want to miss a day of work from side effects. So those were something of barriers. And then as time has gone on, the diffusion of the vaccine myths in the internet and in the Latinx community, to me, feels as if it's grown. And so my few remaining Latinx patients who are not vaccinated are hanging on to that. And it has become difficult to convince them otherwise, though I sometimes succeed. I think that human touch and talking to someone they trust is really an important aspect. What do you think, Ileana?
Yeah, I completely agree. I think we come from countries where we are really into vaccines, actually. Like, we were all vaccinated very young and never complained. Never even asked. I don't think my mom asked, hey, what you're putting in my child? Like, it was a given. You were getting your shots and that was good for you, and that was it. So yeah, most of us who got the vaccines at the beginning of the rolling out of the shots, I think we came with that understanding, like, yeah, it might have some side effects, and that's a risk I'm gonna take to protect my health, to do something good for my community. But yeah, of course, I think a sort of level of curiosity and asking questions is healthy. The thing here is, who do you ask? Who are you? Where are you getting your information? So as long as they approach you, doctor, that is totally fine, because they trust you. You are an expert in your field. So you're going to answer with an honest truth. And I think that's really valuable. And that's something that can shift someone's mind around the vaccine. But if you're getting it only online and you're not verifying your sources, then fear can really overcome the situation. It can take over. And there's a lot of mistrust, I think, still. And then there's this perception like they either got COVID, so they are already immune, or I mean, that's a belief, or like, we're all gonna get it, or even if you got the shot, you still get it. So what's the point of getting something in my body that's external, and I don't know what that is. So I've seen that. And as you mentioned, like, as time goes by, I wonder, like, if people who haven't gotten the shots are really, they have already made up their minds and might not get it. But yeah, that human approach is really important, because you can really have an impact on individuals when they trust you. And again, as Carly mentioned, not just the professionals, but those trusted faces and leaders in the community. Because sometimes when you ask them, but where do you get this idea? And it's like, oh, I got it from my neighbor or my friend, or someone who got it really bad from the vaccine. And maybe it's not even related to the vaccine, but anything that they feel that's going wrong with their body since they got the shot, even if it was like months ago, they think and they still believe that it has something to do with the shot. So yeah, there are a ton of barriers, I think, still. But I mean, cases are going down, which is great. And I hope that we can still change some minds.
Well, I'm sorry, Kathy, go ahead.
Go ahead. It's you.
We're both so polite.
I think there's a big difference between hesitancy, which all of these approaches that everybody's talking about really work with, and resistance, Carly mentioned, and then animosity. I mean, we saw a lot of, I would say, vaccine animosity, and those were folks that weren't hesitant. Their minds were completely made up, and for reasons that they thought were good. They felt it was experimental, it hadn't been tested, it was dangerous, it was going to alter their DNA. It was made from aborted fetuses. They had some reasons that to them were, were a deal killer, and they were they were not going to get the vaccine. We never mandated the vaccine, so we had much more anger directed at us about masks than we did about vaccines. But in talking to folks and folks who would come to the commissioners meetings, I would say the vaccine hesitancy was one thing. The vaccine, no way I'm getting that, is another thing.
Well, I was going to say, I think, we live in a period where there's a strong mistrust of institutions, and in many cases, a justified mistrust of institutions. And so I think what many of you are saying about people being more receptive to a personal connection is true, and it's helpful, but it also can be misleading because it depends on what those personal connections, like you said, Ileana, where they're getting their information from. But that did factor heavily into how I approached the comic that I did about it. Because I think if in our presentation of the information, if we feel to a person like we're an institution, or we feel like we are aping the words of an institution, people are more defensive about it. But if you can create an emotional connection that feels more like personable, like a conversation between two people, it's easier to get the information out in a way that doesn't flip those switches of defensiveness and anger. And so, so I just thought it was interesting because you guys all talked about that. And that is the approach that I took in creating the educational comic.
I think that's one of the things that we wanted to do by creating a comic, because it's a much different format to talk about something that's serious. And I got the idea really from your strip in the Colorado Sun that you don't hesitate to have conversations in a very short and concise way that people are sometimes really afraid of doing in person.
What I would also like to add to that, what really struck me about the stories that you were telling through that comic strip is it mirrors what we found out through our street team efforts, is through the hesitancy to all the way to that animosity and like hyper resistance, is that if you can if you can have that conversation in a respectful manner and get to the root of like what, because all that anger, all that anxiety is based around a fear. They are afraid. If they don't want to say that word, I get it. So it's a little, let me not put words in anyone's mouth, but there is an anxiety there, right? They want to do what's best for their kid. They want to do what's best for them. They want to do what's best in this scenario where there's a lot of competing information around them. And what we always found is if you were able to help articulate what that fear was and then acknowledge it and hear that, hey, I get that, that's really, really helpful to not trigger that defensive reaction, is like, I get it. This is a wild time, and I thought the way that you told those stories through that comic strip was a really, really eloquent and excellent, wonderfully casual way to sort of bridge that gap. So it was really, really cool.
Well, I'll say one of the things I found in using art to deal with tough subjects is that when it comes to people who disagree with me, whether it's in the extreme of like white supremacy or social policy or whatever it is, I think that there are maybe, I'm going to say 10%, I'm just going to make up that percentage, but I'm going to say 10% of people who are intentionally trying to do an evil thing. And those people I'm not going to reach anyway, right? But the people that are under the sway of that 10%, those are people who are led by their genuine concern for family and life and protecting the innocent. And if they are being misled, then if I do not treat them as an enemy, if I approach them in a way that connects with their compassion and their concern, then they can sometimes find their way to what it is that I'm saying. And so that's something that I try to do in art a lot.
Successfully, I would say.
Thanks.
So on another bent, I'm wondering how did you balance the public health versus individual responsibility when talking about vaccines in a, in a governmental way. How did that play? I mean, how did that play a role, and did they compete, or were they, complementary or non-existent?
I'll jump in, and others can too. That's a really great question. And the people who were angriest and who spoke the loudest at our meetings were ones who felt like vaccines and masks were opposite of freedom. And there was a whole sort of conglomeration of religion, patriotism, freedom, and COVID that was sometimes pretty difficult to sort out, I think, even for the people who felt like that. But it became it wasn't a conversation like this about, what does the science say? And here's another study, and what do you think is best? It was a very emotional discussion where people felt like their very freedom, their love for their country, their love for their faith was threatened because we were asking them to wear a mask or we were recommending that they get vaccines. So it became a very difficult conversations. The only way that we were able to address it, I think, was to get back to what Alan said and talk about values. Everybody wants their children to be healthy. Everybody wants their grandparents to live. And so occasionally we were able to realize that we all had those same goals. It was much harder to get to an understanding of what we should do about it.
Well, that kind of brings me to another question, which is, I had, as a recipient of this grant and as a distributor of information to you guys and to people who are here at the library, I have a lot of information from government sources and research institutions that talk about how successful the vaccines are, how important they are for public health. And when I'm looking at those, I accept those as true. So how do you reconcile, that basic acceptance of information as information and not misinformation? Because if somebody is getting their information from another source, who am I to discredit that source? And how is discrediting a source really the answer in getting, in dealing with misinformation and in getting true information, which seems like it's becoming a much more mushy kind of a word? How do you really get truth out there? And I think that this vaccine issue is a really important one in that discussion. I'm just wondering what y'all think about that.
Well, Kathy, a pundit who I can't recall once said that the information age really represents the end of knowledge, the end of actually feeling as if you know something, because there are so many contradictory opinions flying around. And there's, as we've discovered, there's a lot of gaslighting and misinformation intentionally being spread. The question I'm always asking myself, okay. Jordana joined us, and her kids. Hi, Jordana. The question I ask myself is, where are the conversations about what it means to be a citizen in a democracy or in any country? What does it mean to be a responsible participant in citizenry in a democracy? And as an elected official now, I'm very sensitive to it because we are, as Kathy will share, we're constantly being assailed, and this was a pretty heated issue. You're on your Board of Health, the commissioners there are the Board of Health. I'm the chair of the local Board of Health, so we're getting all this information. And the distressing part for me that I still have trouble with is, where was the conversation about responsibility? I had people saying, well, this disease only affects, immune deficient people or or old people. So why should I worry about this? And I really wanted to have the conversation about responsibility. You know, and it's funny, going back to the childhood, as Ileana said, in the playground, we just lined up and they gave us the shot or the sugar cube or whatever with our vaccine. And nobody ever thought to ask, you know, what it was, other than, you know, this is the measles, mumps, you know, all that sort of thing. And it just seemed like this is what we do if we're all going to live together and live happily together. And somehow that's been lost. And maybe that's how we can start reintroducing that at the libraries and in the conversations, is that, you know, what comes with membership in this incredible society we have. And of course, it'll spread out from there. When you were asking the question, I thought, boy, oh boy, that's a question that goes beyond my knowledge in this panel, but why not bring it up now? Because it does pervade everything we talk about.
I agree, Greg, but I can tell you that when I tried to use the moral argument, the duty to the community, the taking care of others argument, I don't remember ever getting anywhere with it. People are concerned about themselves, and which is a very disappointing thing to say about our society, but that's what I found. I never felt that particular argument. I would say, you know, the Pope is saying that everyone should get this, so that it's our moral obligation. I never found that to be convincing.
I was gonna say, if you invoke the Pope and people are not listening, then you know that it's pretty strong.
Right. I mean, this is a largely Catholic community.
Yeah. I gotta say, I think that in my experience, fear short circuits compassion. So when people feel very fearful, they jump to anger, they jump to hate. And I think right now, American society in particular is full of a lot of fear of the other. And so those places where even 15 years ago, we would have expected a certain degree of compassion for others. I think until we deal with the sources of these fears, people can't even get into a compassionate place, which, you know, I wish human beings were better at that. But that's the other thing that I really try to focus on in art, is sort of creating a place of compassion, connecting our humanity to a group that we don't recognize, or you know, just showing the humanity of the other. And so much of that fear is just, it just chokes out any concern for anyone else. And yeah, so hopefully we can find a way to sort of reduce the fears, and maybe some of that compassion will come back.
And I think to piggyback off of that, I think that that's exactly, in my experience talking to individuals, if you can get them to that point where they are able to express what that anxiety is, because oftentimes it's a little less to do with, at least within the construct of masking and vaccines, it's less to do with I'm worried about my personal safety, because that's not really it, right? They all kind of, the argument is, I think I'll be fine. It's not an issue. Their real anxiety is with being told that they have to do something. They have to do this. And that speaks to an anxiety, at least in conversations that I've had, with a distrust in a system. And if what I have been able to do in these talks is sort of, if you can redirect that and be like, you know what? I hear that, you know, like our systems are a little screwy right now. I get it. It is hard to know where the right information is coming from. It is hard to be told by individuals that you don't feel represent you, that you have to do something or you have to act a certain way. And so if you can acknowledge that anxiety and then redirect and be like, but you know that the vaccine works, right? Like, you know that that's the case. You just don't want to be told that you have to do it from somebody who you feel doesn't have your best interest at heart. And those conversations have been really successful. If you're able to sort of redirect that narrative back towards the root of, you know, like identify the anxiety, but then also sort of redirect in this really positive, reconstructive manner. I've had really good success with that. And that's in communities that I represent, that, right, that I would be considered within. We also had really big success with Ileana. Sorry, I'm going to call you out because you're here, but with Ileana and La Tricolore, being the community leaders that they are for their group, and working so closely with them as those community leaders to act as that compassionate space to receive good information for their community, for your community, I think is really important, right? Is that representation and that power structure for where the information is coming from, I think really changes in how that information is received. And that it's hard for me to go talk to groups that I don't know their struggles, right? Like I can't identify with that. I can listen as best I can, but having those community connections and those community leaders to really help distribute that information, I think has been really, really successful.
Yeah, and I think that something that I found really useful is acknowledge the fear, acknowledge the sentiment behind that hesitancy, and then approach it with a more, try to tap into their logics and use like numbers, because it's very easy to get influenced by what you see around you, by experiences nearby. But when you look at the numbers and you see, well, it's a tiny risk compared to the risk that you are in if you get the COVID, actually, right? Which is also something external that you don't know. Like it's not like you're getting something that you already had when you get COVID. Same with the vaccine, but the vaccines are safe. But yeah, so I think there's talking to them in terms that they can understand, that anyone can understand, with compassion, with respect, from someone that they trust is really valuable. But also being honest, because I think there's a lot of mistrust around that idea that I'm being lied to. They are telling me that this is something that has been studied for many years, but that's not true. And there's a lot of things that the people might feel like they're being misled, where when you're honest and you tell them you might get side effects, yes, you might feel terrible even for a couple of days, and you acknowledge that fear. And I think that's something that really speaks to someone's fears, and it makes them feel a lot safer. And when you, I even share sometimes like, yeah, when I got my dose, oh my God, I felt terrible, but it passed. And can you imagine if you got the disease? I mean, if this is the vaccine, how would you feel if you actually got the real thing? So those are conversations that I have. But at the end, I do try to be respectful of anyone's choices, because I think you do what you can, and you provide the information, and you share the available resources, and you connect them with experts. And then that's, I still have to be very respectful of anyone's choices in the end, I think.
I don't want to belabor this point, but I do want to ask, how do you convince someone who is maybe not in the 10% that Alan says, that they're just entrenched and you are not going to ever reach them or change their mind, but how do you convince someone who may be on the fence that your sources are in fact scientific or very reliable, and because that kind of sets you up in a adversarial role, like my resources are, and my information is more valid than your information. And I'm just wondering, because if we are going to have conversations, and if we are going to be having more boosters coming along, and this is not an issue that's going to go away, then how do we have that kind of a conversation? How do you convince people of that?
I don't think it's about explicitly, and I appreciate this question because you're 100% correct, is that it can come off very like, I know better than you, haha. What I have experienced, and I will use an anecdotal example from one of the construction sites that we worked with, is we had set up our street team. We were giving out coffee in the morning because we were having a clinic the next day. A group of guys walks over and literally just start kind of not aggressive harassment. No one was threatened. No one was, but we're like, hey, vaccines are fake, and you're, yada yada, whatever the tangent was on. And as I did, I walked over to one of the guys and I was like, hey man, you mind, can we like have a talk? We talked for probably 30 minutes. And it started as a straight up conversation. I was like, hey, my name is Carly. Like, what's yours? It started with a handshake. It was eye contact, handshake. Where are you from? What are you doing here? It was about getting to know them and building that personalized trust with them. Is that, hey, I'm not going to try to sell you on it. I want to hear what you have to tell me. I want to know what you have to say. You know what I want to do. You know that I'm sitting here going to try to tell you to get a vaccine, right? Like I don't have to do that. But tell me about you and what are your concerns about this instance. And it devolved into, he was talking about his family. He was talking about his job that he's in. He doesn't like the masking and the work environment. I mean, it was a long conversation and it was truly insightful. And it ended with literally, I looked at him, I was like, I'd love for you to get it, but I respect if you don't. I hope that you enjoy the rest of your time in Aspen and you get home to your grandkids safe. And it ended with a handshake. And he's the one who brought 15 guys over the following day. And it was a lot more about that respect for, I want to know you. And I think that was really that pivot point for that conversation. And so I think just like, everyone here is saying, right, it's about compassion. It's about hearing people out. They know what I want, right? They know that. It is me trying to get them to believe that I'm out trying to help them help themselves, or I'm trying to give them the best tools available, and in this instance it was really successful, and that's not the case all the time, but
that's a great strategy. I was just kind of reflecting on the number of deaths, and I think enough people have died. We've lost 960,000 Americans have died from COVID. We're losing 1,500 a day on average, so it'll be about the 5th of April, we'll be at 1 million. And I think what that means for me is I know several people who've died from COVID now, and I don't know how many other Americans or people living in this country know someone has died, but I'm going to assume a lot of them do. And I just wonder, does that weigh into the decisions? It must, but I just wonder if that ever enters the conversations when you're all, when you're speaking to people who are either fearful, hesitant for some reason.
I have a dear friend who died of influenza right before the pandemic started. And I use that when I'm talking to patients about getting the flu vaccine. Because I think people just don't think about, with flu, they don't think about the possibility of dying, even though it very much exists. So I agree that using as much sort of personal story, and people just, especially people who aren't trained as scientists, do not get data. It doesn't speak to them, whereas stories do speak to them. And if you're going to use data, I think probably a graphic is one of the best ways of doing it. One of the times I was trying to about this with Samuel, Radio Tricolor, Facebook, I said, your chances of having a problem from the vaccine are like this, and your chances of having a problem from COVID are to the ceiling in comparison, because that seemed more illustrative to my audience, to me, than quoting numbers. I'm not sure anyone was listening. No.
We were all, oh, you're talking about them. I thought you were talking about, were we listening? I was like, we're all listening. I was going to say, it feels like we're coming up with this good mixture, right? We're talking about speaking to people with compassion, hearing their fears, connecting with them as a human being, using our own anecdotes or experiences, and then also using our sources. But the other thing that Ileana touched on was making an appeal to their logic. So one of the things that I tried to include in that comic was some of the major fears of like conspiracy. What does it mean when you tease that thing all the way out, right? Like if it's the vaccine is a trick of the government to be able to track us, like to what end, right? And we all have cell phones, right? So that's pretty much already happened. Me trying to make that point of how hard it is to get any governments to work together, like people within a single government to work together. So do we really believe together that all of the world's governments have conspired to give us free medicine to do whatever nefarious thing that we think? I mean, just even in the tragedy between Russia and Ukraine right now, like we see that the likelihood of all of the world's governments coming together to participate in a conspiracy is very unlikely. So it seems like having all of these things sort of in our toolbox to use when we're communicating to people are going to be useful.
Yeah, I think that's a really good point. And when you're talking about the stories and that personal connection, that sort of gets to the trusted source. So Kathy, you started off this section by asking about how do you deal with competing data? And we had every week people brought in, read this, and they felt like they had done their research and they had binders full of information, which contradicted what they were hearing from our public health team. And one thing we haven't talked about is how this so unfortunately was politicized. And I think that people did just trust their person, and it unfortunately became a political debate when mostly public health is not a political issue. This one was, so it was mixed in with all the things. And I loved how you included in the comic the information about the syphilis experiments. There were those things that happened, especially with people of color and marginalized communities. So it seems like there's usually a little kernel of truth in people's fears and thoughts about conspiracies. And it's, figuring out who could be a trusted source that wasn't one of these far sides on the political spectrum. And I think it's easier in local communities. And I think maybe that's why Eagle County, Pickens County, some of our local smaller areas have had more success with vaccine, because there are more trusted folks in those communities, perhaps. But that politicization of a public health issue was really difficult, I think, to deal with.
I think that also the trusted source and the individual conversations kind of leads into a discussion of maybe a short discussion about the internet. And there is ample information, whatever it is that you want to believe, that will back you up. But I think that what I hear everyone saying is that a one-on-one conversation trumps the getting the information from the internet. And, that sort of sets up a whole other industry for future public health crises or campaigns. How do you anticipate, revisiting this issue with, let's say, a booster in 4 or 5 months? We'll have to.
No one else wants it.
Go ahead, Carly.
No. I think that the internet and this kind of mass access to information is that double-edged sword, right? I think I read a really interesting paper a couple months ago about how this is the first time that the world, as like an entire human population, has watched science happen in real time. And that science is not linear, right? Like it is all over the place. And that is a potential argument for why it's been so difficult to have people kind of watch and wait and see sort of what this is happening. And so that being said, the internet is also an incredible tool for being able to distribute and disseminate information across huge swaths of the population. And if we've done our job over this last 2 years and all the rest, if we've done our job and we are those trusted sources and we've built those relationships and we've built those inroads into these communities, the internet can be that space to be able to kind of use as a soundboard, to be able to kind of light the signal fires and really get the word out really rapidly, that things are changing. And so I think that all this groundwork that everyone here has done to kind of build those connections in that very in-person way only leads to kind of this easier mobilization down the line. And that if we can really focus on that trust building and those networks, that can only serve us better in the future.
That's what I love about Carly and her team, is because she has just put such a good optimistic approach to this, and it's so important. And I just want to thank you and Jordana as well. This is part of it, is just being able to be resilient and to maintain that optimism. I can't say I've shared it all the time. I'm generally pretty cheery, but this spring it kind of got to me, this earlier in the season, and it's so good to have you and all the smart people in our public health department having our backs. And I'm also just so grateful that we have a community that supports our public health department, because we did see in other communities, other counties around the state and around the West that had really terrible situations where they chased all the people who knew what was going on out. That was hard. That was hard to see. So I think we all did pretty well, and knocking on wood here on the wooden desk. The thing that I was going to bring up, and maybe too much of an aside, when it comes time for a booster, I'm certainly hoping the news and the data will be there to support it. And I'm going to say it probably won't happen unless it is, and it becomes a national news thing again for a booster shot in a few months. I keep thinking, and wondering and asking, what have we learned from this experience? And it may take us several years to unpack it all and process this, but what have we learned from this experience that we can apply to the other long emergency I like to talk about, is the climate change emergency? Because hopefully some of the tools we've gained here regarding information and process and response to an ongoing crisis is the sort of thing that will serve us well with that. And that's another topic, Kathy, but we'll bother you about that next time.
Climate change is not a bother.
It's a continuous bother.
Yeah. Well, I want to thank everybody here. I know, but for instance, Kathy, you really went to the mats there on the whole masking issue, and that was unpleasant but resolved. And everyone's doing their part. I think that the thing that really rings true that you all said is that it's a person-to-person compassionate discussion. And I hope that is what we're able to have at the library on any number of topics. And I'm grateful to Alan to accept the challenge of talking about vaccines in a graphic essay, so that we can disarm people a little bit, ourselves and people who may not agree with us, in talking about something that's important and that is not going to go away, and that we can come to an understanding together and not be accusatory or political about it. So I do want to thank everyone for coming and speaking. And if anyone has closing comments, please go for it. Or not.
I'm going to have to catch my bus. So if you don't mind, I'm going to bow out. But thank you for doing this. And it's great to see you all.
Thanks, Greg. Thanks, everyone. Thank you so much.
Thank you, guys.
Thanks to the library for doing this. I mean, I think you are exemplifying what everyone here has said. It's the personal connection, it's non-judgmental, it's compassionate, and it's being willing to take on the tough issues and model to everyone, how can we talk about this as a community? So thank you.
Thank you, Kathy. All right,
Well
stop by the
said.
library to get
Thanks.
your copy of It Ain't New, Dude in
Can't
English
wait.
and Spanish. Thank you. Good night.
See you guys later.
Right.